Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, of course, it's a guest from Lima Dental Association. I don't know if he's a guest anymore, but Dr. Wesley Shankland.
Good morning, George. How are you?
I'm doing just fine.
Great.
I heard a lot about sleep apnea.
That's right.
What is it?
Well, you're speaking primarily about obstructive sleep apnea. That's been a big thing recently, and traditionally this has been treated by physicians with CPAP appliances. Obstructive sleep apnea simply means that one begins to stop breathing or totally stops breathing while they're sleeping. Ooh. And it can be quite detrimental. It can be very bad for the body systemically, can cause a lot of problems. But a lot of people in the audience probably hear their spouse, generally the wife hears the husband, absolutely stop breathing for as long as 30, 40, 50 seconds a minute.
Scary.
It's very scary. And that kind of problem can not only disrupt the listener's sleep, but more importantly, it's very detrimental to the one who has the problem.
Well, what causes this?
Well, that's a great question. Obstructive sleep apnea used to be thought of as an older guy, fat guy like me, you know, disease, but it's not. It can happen to younger people who are thin as a rail, who have no body fat. What happens is the throat actually, when you're lying down, the tongue actually falls back and can occlude or obstruct the airway. And it can also be caused by, if somebody would have a glass of wine or a beer before they go to bed, their muscles relax. It could be caused by the other muscles in the throat relaxing. And this problem causes the air to be cut off. And because the air is cut off, they have cardiovascular risk, they have a higher rate of stroke, heart attack. There's a real association with type 2 diabetes and all kinds of problems like that. And generally, the physician's been treating these with CPAPs. But CPAP has a mouthpiece or a mask on it like this. It's obstructive in a sense that you can't move around. You got to carry it with you. Where we at Lima Dental Associates can treat this comfortably, most of this, with an oral appliance. That we make an appliance, we insert it in the mouth, it brings the jaw comfortably forward, and by bringing the jaw comfortably forward, it opens the airway. So if this is the lower jaw, we bring the lower jaw forward and the airway comes with it, the tongue, and it doesn't cut off the airway. It's very effective, it's very healthy. So we treat a lot of people for this problem.
Okay, you want to talk something about volunteer to watch the Buckeyes?
Yeah, the volunteer to watch the Buckeyes. We're having that where we're still giving tickets for the OSU-Michigan football game coming up along with a parking pass.
No, you can't beat that.
You can't beat that.
Thank you, Wes.
Thank you.
That's our report for today.